Ladies and gentlemen, boys and girls, my name is Subrata Sarker. I'm a mechanical engineer working in manufacturing industry more than 22 years. Today I'll be discussing a topic which is not the topic for the engineers but the doctors. But I think the basic knowledge of this type of medical knowledge has to have by everybody so that we can take care of ourselves and we don't need to go for hospitals and all this. So one of the important, or nowadays you will find that many people have kidney stone. So today I'll discuss about the 4-5 points of the kidney stone. Number one is what is kidney, how the kidney functions, stone formations, stone type, investigation, treatments and prevention of the kidney stone. Now in our urinary system we have two kidneys, then there is a ureter and bladder and then urethra to which urine passage. This is basically the system. Now basically kidney is a very fine quality of the, you can see here in this animation, fine quality filter in our body which purify our bloods. This is the function of the kidney. Now through blood there are a lot of minerals etc. passage, and sometimes it got, when the concentration of those are much higher, it got stuck in the inside surface of the kidney and later it creates the stone formation of the kidney. And if we discuss about the causes of the stone formation in kidney, number one comes actually basically high concentration of the urine. For any reason, if your urine concentration is much higher, then there is a huge chances of formation of stone in the kidney. And it is basically those who take less water, or the environment or the geographical region where they live, there is a high temperature zone like that, that also causes kidney stone formation. Imbalances of pH in the urine, that also causes kidney stone formation. Hyperthyroidism is also lead to kidney stone, and there are a lot of medicine actually. If some people take continuously for months and years, there is a huge chance of kidney formation. For example, if somebody is taking calcium tablets for months and years, there is a high chance of formation of kidney stone. So we need to know actually what are the causes of the kidney stone. There are 4 basic types of the kidney stone. Normally, calcium stone, uric acid stone, struvite stone and cystine stone. Now where the stones are formed actually in the kidney, it can be inside the kidney, in the lower, middle or upper calyx. It can be on the ureter, on the tubes coming from the kidney towards the bladder. It can be inside the bladder also. So there are basically 3 areas where kidney stone formed actually. Now, what is the size of the stones normally? It can be from 2 to 3 millimeter to up to 30 millimeter. It can be this much of size, it can be very small. If the stones are very small, we don't actually feel, even it sometimes passes out through our urine, but maybe up to 6 millimeter. But if it is, actually it depends on the location of the stone also. Size, stones, location and size is both are important actually, which may come out easily from the body. Don't need any medication or treatment or operations. Now, kidney stone gives a very severe, or unbearable pain, and it gives on the back side, sometimes on the front side, and it can give many times, front and back, both side pain together actually. And especially if when the stone start moving in different area of the kidney, it gives a unbearable pain. You can see here in this picture, stone is moving, then it gives a huge pain in the body actually. Then immediate need attention. Other than the pain, there are other symptoms also, which is basically for kidney stone. Number one is the blood in the urine, urinary infections, bad smelling of the urine, pain while urinating, and feeling sick and vomiting, and urge to urinate more than the normal. These are also indication of the kidney stone formation. The investigation, medical investigation is normally USG ultrasonography, by which you can identify whether there is any stone in the kidney or not. Sometimes also there is another investigation process called IVP, intravenous pyelogram. Is a basically dye inject in the body, and it can be also seen that whether there is a stone or some other issues in the kidney also that can be checked. Now, if there is a stone found in the kidney, it doesn't always need that it has to be operated. Depending on the size and the location, the operation whether needs to be operated, or if need to be operated, which type of operation needs to be done actually. Many times, like, or I can say level 1, the surgery 1, you can say ultrasonic shock wave. It doesn't need to cut or something surgery in the body. From the outside of the body, ultrasonic wave is given, and the stone got broken in small pieces and naturally come out through the urine. And depending on the location, there are different types of the machines. The second type of surgery is a lithotripsy. This instrument inserted through the urethra, to the bladder, and then to the required position where the stone is there, and then it goes and it starts, you can see here in this video how this stone is breaking, and then it can come out from the kidney. And the third or the last or critical, many times what happens, size of the stone is so big and the location is so critical, it cannot be approached through lithotripsy. Then the option left is, piercing from the back of the person, backside, where the location, then instrument inserted on that location, and breaking the stones and getting it outside actually. Now, it is seen that a person who has done kidney stone operation one time, it is repeating. It is a very dangerous matter actually. Many times, many people done 2 times, 3 times. But if we know what are the causes actually formation of the stone, it can be prevented. Number 1 and foremost prevention for the kidney stone is the person needs to take at least 4 to 5 liters of water daily, but not in a single time, continuously, so that wetness inside the body will remain a consistency, and or rather as an output 2.5 liter urine should passes. And number 2, to avoid complete animal protein, fish, meat, chicken, etc., 100%, non-veg to be avoided from your food. And there are a lot of fruits like apple, grapes, etc., melon needs to be taken with more quantity. And the food with, having calcium or oxalate to be avoided. So if you find this presentation is interesting and informative, you can share with your friends. And if you have not yet subscribed my channel, you can subscribe my channel by clicking on the bell icon. You can get my notification for future presentation. Thank you so much for your attention and time.